So we've already spoke about how to prevent running injuries, but injuries do still happen and they do still come into clinic, and I wanted to talk to you briefly about what we do when we're treating running injuries. So the first thing we want to do is take a look back at your training history and just try and spot any of those common mistakes that we've already mentioned. Have you suddenly changed your mileage? Have you suddenly changed the terrain or the amount of hill work that you're doing? Have you been doing a lot more work on your pacing? And looking to see if any of those things have possibly influenced it, because what we can do then is just adapt that program slightly to allow the tissues to recover, but also to keep you training while that happens, because that's quite important. What we don't want to do is in the time of injury is just start to lose that fitness and start to lose that total volume, because it can be a lot harder then to get going back into your training program further down the line. The other thing we do is we do a bit of an assessment. We look at different strength and movement characteristics. We see what your endurance is like, what your strength is like, and see if there's anything that we need to address which is possibly contributing to the injury coming on in the first place. So common one that we see is plantar fasciitis. Now that commonly occurs with changes in mileage, but also occurs when people are just getting very tight and weak through the calves. And addressing those characteristics could have a massive effect on keeping you training and keeping you healthy into the future as well.